Hi, everybody, and welcome to Data for Good Symposium. My name is Jean Holm, and I'm the Chief Data Officer at the City of Los Angeles and involved with the organization Data for Good. We welcome you here today to our first event on data literacy, and today's event is around healthy communities and how data impacts our lives. Data for Good is a new organization, and I just want to give you a little context. It's a group of Southern California folks focused in the data science community, but not all of us are data scientists. We try to think globally and act locally for things that help in Southern California, but also might help in other places around the world. We represent community leaders and organizations that strive to use data and technology to do better and to give back to our greater community. We're always looking for volunteers and new members. One of the projects that we're working on is this series of webinars around improving data literacy, particularly for folks who may not be data scientists themselves. So hopefully we're not going to use any terms that people are unfamiliar with today. Data for Good was founded by Subhash Siddhazi, who runs the DataCon LA event and a variety of other activities throughout Southern California. Data for Good's initiatives have begun here in Los Angeles and Southern California, but we have lots of different programs and initiatives for people to get involved with. So here today, we're going to be doing a few different things to help you guys stay engaged. We have two amazing speakers today who I'll introduce in a moment. And then we're also going to be doing polls throughout this webinar. So as those pop up, if you don't mind participating, we'd love to get your feedback on things that we're doing right, things that you'd like to see in future events. They should be quick and painless. And after this, we'll be getting a set of surveys, a single survey going out to everybody to be able to ask you questions about how we can make this series better. So we thought that really very timely. We wanted to talk first and foremost about healthy communities. We've all been awash in all the data around COVID and the impact it's had on our lives and the tragic deaths that have happened. There's also even further implications of the strain on our health care system and how that affects people who may not be suffering from COVID, but have other issues going on. Our speakers today are really focused on how they use data to bring forward the services that people need in Southern California and how those services are really geared to improve the health and communities. So today I'd like to introduce our speakers. The first speaker is Danielle Cameron. She's the Chief Strategy Officer for the National Health Foundation, where she shapes the vision and manages strategies for the organization. Previously, she was the Director of National Development at NHF for 7 years and held different positions in childcare and senior services fields and program management and fund development. She's managed multi-million-dollar grant portfolios, led numerous community-based programs, and provided consultative work in strategic planning, fund development, and operations. She's consulted nationally on the development and implementation of intergenerational daycare. I do want to do just 2 quick points of housekeeping. One is that this webinar is being recorded. And so we ask that you just understand that as we start our event so that people who aren't here at this moment are able to also get the learnings. We do have active chat, so if you have questions, queue them up in the chat or in the Q&A function, either way, and we will be addressing those to our speakers as we finish. Danielle, thank you very much for being with us here today.
Thank you. I appreciate the opportunity very much.
Can you tell us? Yeah, go ahead.
A little bit about National Health Foundation. We are based in Southern California in Los Angeles, and we provide services to Ventura County and Los Angeles County and looking beyond that. Our mission really is to improve the health of under-resourced communities by tackling social determinants of health. So looking at the walkability of neighborhoods, the access to healthy foods, quality education, so on and so forth. And so we're really looking to make those upstream changes that can impact communities across the region. And so we do that in a number of ways. We have some direct service programs. One of them, the most significant, is recuperative care, which provides housing for individuals experiencing homelessness who are being discharged from the hospital and do not have anywhere to recuperate. We have about 100 beds between Ventura and Los Angeles counties to provide that service. We also have a community engagement team that works in a number of communities in Los Angeles to help individuals that reside in those communities take action on the health equity issues that they're living every day with. But then we also do a little bit of research and a little bit of advocacy work. We're building those portfolios right now, but we really are trying to tackle these social determinants from all of those different angles.
Great, thank you so much. Our next speaker is Dr. Eleazar Eskin. He serves as the inaugural chair for the UCLA Department of Computational Medicine. The department's committed to transforming patient care by leveraging recent advances in artificial intelligence and genomics, and has provided a hub for collaborations across UCLA's campus around scientific discovery and biomedical data sciences, and works with the UCLA health system to apply them to improve patient care. So it's right in the line of what we're doing. Dr. Eskin's also participated with the City of Los Angeles on a recent COVID computational challenge where we were looking at location-based risks for people contracting COVID. Dr. Eskin is a recipient of the Alfred P. Sloan Foundation Research Fellowship, and his work is supported by the National Science Foundation and the National Institutes of Health. Dr. Eskin, can you tell us a little bit more about the work that you're doing and how data informs it?
Thank you, Jean. It's a great honor to be invited to the Data for Good seminar. I really appreciate this opportunity to talk about some of the work that we do. So I'm the chair of a new department called Computational Medicine. Our goal in the department is to transform patient care in the UCLA health system by leveraging AI and genomics. Everyone's health journey is informed by data, and understanding the data is the key to providing the right treatment. To fully understand the data, we need the expertise of three different worlds. We need clinicians who see the patients, we need medical scientists that understand disease, and we also need data scientists and engineers who understand artificial intelligence and understand extremely large and complex data. That's, I guess, why we're all here today. The department is building a bridge between engineering, medicine, and the UCLA health system to build a community of data scientists that work in medicine. And our goal is to not just improve the patient care in UCLA Health, but to have our techniques be used all over the world to improve care everywhere. So there's many exciting projects that are going on, which are collaborations with clinical departments, and I'll talk about some of them today. But I actually want to add something else. Since we work at UCLA, many of us are long-term educators, and I've had maybe like 2,000 undergrads in my class, and sharing with others what's going on in our research is really part of our DNA. And in computational medicine, we wanted to give the public a front row seat on how these scientific revolutions transform patient care. And our plan was to launch a seminar series called The Future of Medicine. And our first event was scheduled for May 6th. And it was going to be focused on the data science behind the genetics of depression. You can imagine that it didn't happen. But the idea behind these events is that we want to share some of the latest data and let the audience come to their own conclusions about the scientific discoveries, so we could give people a sense of what it feels like to discover something. And we hope to start these after the COVID period and partner with the city and Data for Good to have this be part of the scientific landscape in Los Angeles in the future.
That's fascinating. I'm so honored to have you both here today, but really, I just want to thank you for the work that both your organizations are doing, particularly the stress with the current pandemic on the work that was already probably pretty difficult in trying to make sure that we're reaching all of our different groups in Southern California and Los Angeles, and making sure that we're providing those services. So first of all, just thank you both for what you're doing. I am curious though, maybe kind of in this current pandemic, how does the data that you've been working with, or the data that you're getting access to, how does it contribute to building healthy communities? And maybe how has this changed during COVID? Eleazar, do you want to start?
Great. So thanks for the question. So I would say that we are very much interested in using data to improve health. And I would say that since the pandemic started, everybody in our world is now a researcher in COVID science. And I can give one example of a project that came completely new that started in the end of March, which is where data science can make a difference. And this example is where data science can make a difference for COVID testing. So as you know, we have a real shortage of diagnostic tests in our society. And if we had many more, then we could really open up society, reopen the schools, universities, etc. And at UCLA, we are developing a new technology that allows us to test tens of thousands or even hundreds of thousands of individuals all at the same time by using genomic sequencing technology, where all of the data is mixed together, and we can use kind of computational data science methods to, even though the samples are all mixed together, figure out which individuals actually have COVID from this pool of samples. So that's an example of how this kind of new technology that we've developed starting in during the pandemic can make an impact.
That's great. Thank you so much. And Danielle, for you, because you're really providing some pretty broad services across the community, not just around COVID, obviously, but that there's been an impact in some way. How has the data that you're using helped to kind of provision or maybe change those services?
Absolutely. So I think, like a lot of nonprofits, we use data to communicate with a lot of different kinds of stakeholders. So we have evaluation data of our programs that we use to communicate with funders. We have internal data that we use to communicate with our staff, and that has to do with polling their engagement or their satisfaction with different things. We use data to do marketing and social media. But we also have a layer of data that we use with the communities that we work with. So in our community initiatives efforts, we're really on the ground with community residents, looking at what they feel are their greatest social determinant barriers to health. And so in a lot of cases, we work with them to develop the data arguments behind that. So for example, we have a health academy program where we're in some local high schools in South Los Angeles. And we use a strategy called Youth Participatory Action Research. And it's really based in social justice principles, but it's where the students learn to gather data and then use them to improve their lives, their communities, and the organizations intended to serve them. And so I would say during the pandemic, that's what's taken the biggest hit for us. We're used to being out in the community, working with residents to identify those issues that are barriers to health and wellness, and working with them because we believe firmly that our community members know best what the issues are and what the potential real solutions are for those barriers. And we help provide tools that help them make their case to make those improvements. And so during the pandemic, we haven't had the opportunity to be on the ground with them. We can't be face to face. It's become very isolating for a lot of the residents that we serve. And so our biggest challenge has been trying to move these to the virtual environment, but also using data in kind of new ways where we expand and can better articulate the experiences that they're going through and how that kind of pairs with some of the statistical data that we use to make our case. So I think that's really been the biggest challenge so far.
Yeah, I think the change in services and how people are provisioning them, especially with things like medicine, where so much of the culture has always been face-to-face, a doctor looking at you or a nurse interacting with you or getting medication directly handed to you or a shot, that these are the kinds of services that, really have been, and yet they're the most needed right now. I think that those are really challenging to try to reposition. And Eleazar, as you mentioned, kind of as you were starting your new webinar series, kind of like we had to pivot so quickly in March and April to figure this out. So both of you have mentioned kind of connecting to the community, and I just wanted to explore that a little bit. The youth participatory research and sort of helping the public to understand what it is like to discover something. I don't know if that's really citizen science or the idea of like having people who are not data scientists contributing to the way in which you gather information. Danielle, maybe back to you first. Can you explore a little bit more about that?
Absolutely. Well, and I think you're touching on an issue that's very current and kind of central to the work that National Health Foundation does. There are absolutely themes of social justice that run through all of the work we do. And so when we look at, you know, what data is considered important, we're really having to do learning ourselves. I know that the racism and white privilege that exists in our society has really, it impacts what we consider valuable, reliable, meaningful data. And so at NHF, especially in this moment in time, we're really working to shift the power dynamic between, you know, institutions and what we've considered traditional experts, and turning it more over into the hands of the community. And so a lot of our empowerment, the participatory action research is trying to accomplish just that. And so one of the examples of that, we still have one of the youth that participated in our Health Academy program is now currently an undergraduate resident with National Health Foundation doing work on park equity. And Naomi Humphrey, she's a fantastic, actually UCLA student. And when she was in the Health Academy program, they did assessments on parks in South Los Angeles. And they used that data and they did assessments on parks in Santa Monica. And they compared the two and found, not surprisingly, a lot of disparity in the quality of those parks. But those youth then took it one step further. In 2019, there was Measure A in the city of Los Angeles, where there was going to be park funding dispersed amongst the neighborhoods in actually the county. And so those youth took the data that they collected and they used it in testimony in front of the Board of Supervisors. So we have these high school students presenting the work that they did to advocate for more equitable distribution of that park funding. And the Board of Supervisors agreed and proceeded to more equitably distribute that funding to the parks and cities and neighborhoods that needed it most. And so that was really our mission and our values in action. So taking this complicated, you know, what can be complicated concepts of data science and research and evaluation, putting it in the hands of our community residents and letting them run with it. Because again, we feel like they know the issues best, and they were the ones who advocated and really had that win for their community.
I imagine that this can be sometimes complicated, and taking data that maybe is anecdotal or qualitative from the community that's sort of non-numerical, and being able to bring that into a scientific context where a lot of the folks are used to working with, you know, rigorous data science.
Mm-hmm.
Eleazar, you kind of live at this cross-section, right, of public interest in treatments and then computational medicine. So in what ways are you sort of doing that engagement with either citizen scientists or this new idea of helping people learn that they can make discoveries themselves?
Well, that's a really great question. And I have to say that that's actually something that our thinking has very much changed since the pandemic started, because we saw this real passion in the public for both just consuming data, doing their own analysis, looking at data. I mean, I think everybody, you know, in kind of April was probably a COVID prediction expert, right? So we started this project called StopCovid19Together.org, where we started surveying people about many things related to COVID and analyzing that data. And we just saw that people were starved for both contributing data and analyzing data. And that's really changed our thinking. And I would say that before the pandemic, our real focus was to focus on the UCLA health system, where we have, a lot of people in Los Angeles are in that health system. So it is an impact on the city. But then thinking that the way that our work would impact other health systems would be other health systems, kind of taking the technology and moving into their health systems. But what happened, based on what happened during the pandemic, we're going to start a parallel track where we are going to be asking people to enroll in research studies where people provide data, and we will try to help use that data to provide insights that can either improve health outcomes of communities or even provide kind of analysis of data to individuals that can also give them some kind of insights about their health. So this is a completely new kind of paradigm that really is kind of the thinking developed during this, during this period.
It's really interesting to hear how both of you have pivoted so quickly. I don't know that it's like 180 degrees, but just how do we incorporate the challenges that you're facing now in this current pandemic, which was predictable, but only in the sense of it was predictable a month or two or three ahead of time. And then trying to see how to provide those and provision those services to your community. So has the data that you've been gathering, either from the public or the data that you're doing, has that changed or improved the types of services or the way you provide the services to the community? Like in what ways have like the basic capabilities changed in anything?
Which one?
Eleazar, sorry.
Okay, yeah, so I would say, maybe I can give an example of where we're collecting data and then we're thinking about how we can use it. So one project I think is really maybe the most exciting project for me, it's very close to home, is that in January, my sister gave birth to a healthy baby boy. And the thing about pregnancies, which creates a lot of anxiety, is about 10% of births are preterm. And no one has any idea of which pregnancy will go to term and which will result in preterm birth. And in fact, there's a huge health disparity related to preterm birth, that different socioeconomic individuals have very different rates of preterm birth. And what some faculty in computational medicine, they identified a signal in the bacteria or microbiome
Eleazar, I'm not sure if it's others. Can everybody hear Eleazar? Thumbs up or thumbs down?
and
Great, perfect.
was
You
I
just got out for a moment there.
Okay, so saying that, so we want to collect the this microbiome from every pregnant woman in the health system, which is 3,000 pregnancies per year, and then with that data, we can try to understand what is it that creates a risk for preterm birth and potentially prevent it. So that's kind of, and we hope that that kind of a project can really lead to many more positive outcomes like the one for my sister. And so that's also an example I wanted to mention, is that where there's a kind of a health disparity aspect, because this kind of data can help us understand what is it about these differences in socioeconomic factors that create these health disparities and allow us to directly address them.
And Danielle, from your perspective, how do you feel that the services have changed or morphed, whether it's data that you're getting from the community or data that you're seeing and how things are changing?
Absolutely. So a lot of the work that we've been doing, as I mentioned, has gone online. And so we find ourselves engaging with residents in a virtual environment and trying to collect a lot of the same information. But with that said, I think we have realized that there is still a deficit of ways for these communities to connect when they're all isolated in their homes. For those that do have access to technology, the residents have really expressed a need for almost like a Yelp of social services. So obviously there are a lot of resources that get promoted during a pandemic, different types of social service programs, government programs, but a lot of neighbors feel like, is this worth my time? Am I eligible? There are a lot of different questions they have, but the ability to connect with each other, to discuss that and to figure it out is still a little bit lacking. And so how do we bring communities together to kind of coalesce around a certain platform, just so that they can share those ongoing experiences, especially in a time like this?
And then I want to go back to something that Eleazar said, which is around maternal mortality rates. You know, there's a group called Measure for America that a year or so ago did an interesting study across the city and county in Los Angeles to look at a whole bunch of different factors about how data is representing how the impact of things that impact your life. And I'll share that link in the chat in a second. One of the things they looked at was maternal mortality rates. So we see one set of numbers kind of broadly applied in Los Angeles, but then what we do is we disaggregate the data, or we break it down into specific demographics. So we take that one number that maybe looks a certain way, but when we break it down across ethnicities or poverty levels or even locations, the numbers can be very different. For example, they found that longevity varied by 15 years, just depending on which neighborhood in Los Angeles you were born in and lived in, that you had on average 15 years less to live for lots of different reasons. When we get to maternal mortality rate, they found that, for example, Black women are 7 times higher to die in childbirth than Latina women in Los Angeles. And the infant mortality rate for Black babies is 3 times as high as the rate for white babies. So we often talk about these broad amounts of data and these broad swaths of data, but disaggregating it becomes hugely insightful in how we can provision services, particularly in healthcare, to be able to affect the people who are most impacted by different issues. But that's also a challenge, right? So in the idea of data science, the disaggregation of data means you have to ask people questions, like we're doing in these polls, that help to understand the different demographics you're serving. Have you either seen these kinds of challenges in the work that you're doing, or how are you accomplishing that kind of disaggregation of data?
So I can jump in. So that's a really great question. I would say that what we're trying to do is to really figure out what is the best treatment for a specific individual. And what we mean by specific individual, we mean that taking into account all the different data that we have on that person, which includes, you know, many aspects of their health and whatever we have. So I think that the difficulty in kind of understanding things like, you know, health disparities is that, you know, when you're just looking at like what you said, when you're just looking at the average, you see one thing, and when you break things down, you see something else. And it might be that in different, you know, for different individuals, you need different kinds of treatments, or there's different kind of health issues going on. And so, you know, UCLA is really kind of inspired by the events over the summer, has really decided to make a major push into kind of health equity as a major theme for the institution moving forward, and really expand the research in that area.
And how are you looking at doing that? I mean, are you starting projects on campus? Are you connecting with different partnerships?
So I mean, both. I mean, there's projects within the health system for the UCLA patients, but then there's also projects partnering with different institutions within the Los Angeles community to look at, you know, to kind of, you know, get a much broader representation of the Los Angeles population.
And Danielle, from your perspective, you know, I think you're very much in the front lines of having to, you know, ensure that services are getting out to folks across different kinds of demographics and different ability to access that service, and people with different access to healthcare at all, you know, even from a financial perspective. How is that sort of idea of taking data and breaking it apart a little bit to understand the nuances of it, but importantly to understand the outcomes, the health outcomes for folks? What's your work been like that?
So I would say that our work happens at those points of breaking down the data, because it's the disparities that we're focused on. And it's those communities struggling with those disparities that we want to work with and support through the process of improvement. And really it's improving those systemic issues that, you know, they had no control over to begin with. And so that is all of NHF's work is where those breakdowns happen. But also I would look at the microcosm of our organization and say that, for example, in our recuperative care program, despite not having a very technical background, I found myself overseeing the customization of the Microsoft Dynamics CRM to most specifically look at our recuperative care guests, the individuals that stay with us for, on average, a couple of weeks after they're discharged from the hospital. You know, previous to having this Dynamics database, we didn't have much that told us about the individuals we were serving. But once we developed that, we were able to track a little bit more of their socioeconomic data, demographics, some of their health outcomes, and then what they went on to do after they left us. And this has helped us retool the services that we provide. Not only does it help us better manage our day-to-day operations by understanding kind of the pain points for our staff in serving these guests, but it also helps us understand, well, when we get certain clients from different areas of the region or different types of service providers, and what kind of needs we help them fill while they're with us, for example, getting IDs, access to benefits, more consistent income, where we're able to transition them to after they leave us changes. And so being able to parse the data and see how we can make internal improvements is another way that we absolutely use that.
So in this realm, we're kind of inferring that it's very data rich, that there's all this data that you could possibly need and that it's available at the specificity, right? So like telling about these different demographics. I'm pretty sure that's not true. I'm pretty sure that there's this whole other challenge on getting access to data at all. So what are some of the data sets or types of data that you wish you had? The city and county are listening on this call, by the way. So what are some of the data sets that you wish you had, whether they exist or not, that would be the kind of things that would inform your work better?
That's a great question. And if I'll start out here, I would say that I think one of the stumbling blocks for NHF is that we're often working at the community level. And the funding institutions that we're going to support our work want to understand the data at the community level. And so often, and this is such a massive challenge in a city like Los Angeles and the county and the number of sheer neighborhoods and people, but having better community level data is critical for us. A lot of times we will be pursuing a grant award, for example, and they want very specific data in terms of the issue we're targeting and how we can make an impact on that issue. But looking at it, you know, from a small neighborhood level is almost impossible in some cases. And so that's why we have really kind of tried to shift our work to focus on extracting the data that's meaningful to the communities we serve instead. And so that we can create the credibility for the work we're doing from the ground up instead.
Great, and Eleazar, in your data wish list, what's there?
Well, I mean, that's a really great question. I think what's really interesting, kind of an interesting development, it really got us thinking, what kind of data is there beyond the typical health data that's really in electronic medical records, medical images, the data that the health system has, which we work with. But one data set that I really would like, and particularly, you know, kind of a Los Angeles wide project, would be to think that in today's world, almost everybody has a smartphone, which has many sensors on it. And there's apps that are, you know, many people are wearing Fitbits and Oura rings and, you know, Garmin's and step counters. And there's tremendous amount of data that we can use to study people's health that would really give us a lot of insight. So one of the things that we're planning, you know, as the pandemic winds down, is to really transition some of our work on tracking individuals and their symptoms for COVID into looking much broader at people's health. And we hope that this would really, we would get a lot of traction with people in Los Angeles wanting to both be part of the study and, you know, contribute data, and but then also be part of the team to help analyze that data. Because I think that's there's a real tremendous opportunity for this kind of using these kind of sensors to identify people who are getting sick, and we could potentially improve people's health as well as learn a lot about disease.
Yeah, that kind of brings up, I guess, two pieces. One is that everybody is really part of the data ecosystem, right? I mean, we're not organizations and individuals aren't in this alone. We all need to think about the data that we have and that we can share, as you said, Eleazar, about like the data you're looking to collect with the Stop COVID-19 project now, Stop COVID-19 Together, and other issues. One of the things we're doing at the city, for example, is we're working on air quality. And part of what we're asking people to do is to, if they have a air quality sensor, like a purple air sensor, to share that data, which mostly is a default, but people do. People share that data a lot, and that helps to inform all of us about the quality of air, but also for data scientists to do predictive analytics on what the air is going to be like tomorrow or next week. And so there's ways that people can share data that maybe isn't super personal, but I know that we also are asking people during this time to volunteer if they're interested in the Stop COVID-19 project Together, downloading the Safe Pass application at the county in the city, which is a way to be able to see if you've been in contact with somebody who has contracted COVID and might need to get a test. So I think there's lots of ways in which we're doing that kind of work. It does lead to an issue. I think, Danielle, you kind of brought this up at the very beginning around this idea of, embedded racism and embedded bias. So there's lots of ways in which the work that every organization in America, probably globally, but I'll just speak for our country, has created processes and policies and access to services that intentionally or unintentionally sort of are not equitable, right? So we expect, Eleazar, as you said, people have a smartphone, but 20% of our population doesn't. I work on closing the digital divide in Los Angeles. In some neighborhoods, 50% of our households don't have internet access at home. So as we start to think about this, what is the role of groups like yours in helping to raise up that idea of bias or ethical use of data? And in what way are you either working towards that or are you concerned about it? And Danielle, maybe I'll go back to you.
Sure, thanks. I would say first and foremost, the individuals that I work with are constantly assessing what do we not know, because there is so much. And this is an area, and that's, I hate to say it, but a little bit new for us. Understanding that the data that we collect has been informed by racism, although it shouldn't be surprising, still remains a little bit so. And so it's a constant education for ourselves that we must do to get better at it. And so the work we're doing is really trying to shift that power dynamic away from what we consider important and essential and put it into the hands of the community. Because again, we feel very strongly they know what's best. They're living it day to day. And so they have voices that are too often ignored. It's not that they're not loud enough or don't know what to say or how to say it. I think they're too ignored. And so we feel like our role is to be a pedestal, to be a support for those communities. And then to turn around and engage with the stakeholders we normally engage with. I think that a lot of the foundations we've been very lucky to work with are very bought in to continued learning around these topics, especially health equity and data equity. And they continue to be very open-minded and have a lot of conversations about how we change the way we evaluate and share data. And so I'm hopeful that more change is on the horizon, but it still is a day-to-day learning effort for us.
I agree, and I think that it's helpful. But both of you have mentioned repeatedly how much you connect with the community and get feedback from the community, and I think that's just a real testament to kind of that idea of openness and transparency and the delivery of services. And I think it's really incumbent on all of us to kind of try to emulate that behavior. Eleazar, did you want to add anything about the idea of sort of ethics in data?
Yeah, I really want to emphasize, first of all, I think that Danielle's organization is a real model for connecting with stakeholders in the community. And that's really critical because even when we work with people in the health system, which is right across the street, our only projects that are successful are ones where everyone's in the same room, right? So you really can't affect, health outcomes just in front of a computer analyzing data. That never really makes a difference. You have to really be out in the community and partnering with community organizations and stakeholders. The other thing, which I think, just came up, which is this issue of, bias in data science and kind of understanding equity in data science. And there's actually been really tremendous progress in the last 5 years on understanding in artificial intelligence how bias happens and developing new kind of analysis strategies and new kind of techniques to mitigate inherent bias in the data. And it's not completed, it's not like it's there, but it's completely finished. But there's huge efforts in that area, and there's a very active research field working on that. And so I think that, we're really, because we're, like institutions like UCLA, but then I think the public is very conscious about it. Every time we think about deploying an algorithm in the health system, there's definitely a group that looks at it to understand, is there like a bias component here? Is this a real kind of medical advance, or there's some kind of bias that's creating it? And the bias actually, I think, has two impacts. One is obviously there's like a societal problem, but also these biases kind of take away from how well these technologies work, because if you're just predicting something based on health disparity, you're not really understanding what's causing that from a disease perspective, and your method isn't going to make an impact. So that's we talk about that almost every day, that kind of work.
Yeah, it's a challenge, I think, that we're all working towards solving together. So I'm going to pivot a little bit now to our audience questions. We've got quite a few backed up here in the Q&A and the chat, so thank you for submitting those, folks. I'm also going to turn it around and ask you all a question. So, just go ahead and post this in the chat as we kind of continue on our conversation. But the question to all of our audience members is, how do you use data in your work? Or how would you like to use data? And it's fine if you don't have any technical background, but I think you're starting to see from both of our speakers today how data can be really important, especially when you're having to change things to address audiences that maybe you didn't understand had different needs before. And so we'd love for you to be able to connect in about some of the ways in which you'd like to or are using data. So while folks are able to post those in the chat, I'm going to just kind of spin it around to our presenters again. So this question is from Pamela Marsh-Williams. What barriers are you facing from individuals who are reluctant to having their personal data shared?
So I can actually talk about that. I don't see those as barriers, because I think that people should only share their data when they're really comfortable sharing it. And I believe that if someone doesn't want to share it, that's completely their decision, and we respect that. And the goal is to create a culture of trust and of sharing, that enough other people share their data, that we have enough data to really push these projects forward and make the health impacts that we want.
And Danielle, did you have anything to add about this potential reluctance, or I don't think we have to say potential, there's a reluctance, founded or unfounded, for folks who don't want to share their data?
Mm-hmm. Luckily, in a lot of cases, we're not collecting a lot of personal data, but more experiences of our residents. And so usually the residents that we're engaged with are there because they want to share their experience, and because it really, I think, brings to light what a lot of the statistics are that we can access through public data sources. And so it's through their experiences that we can, really bring everyone around to see what's going on in a community. And so they're really instead of reluctance is a motivation to do that.
And you've kind of addressed, Pam had a follow-up question too, which is what strategies do you use to build trust? And Danielle, I think you kind of just started to address that. But if either of you have anything to add on how to build trust with your community.
I mean, I would say that, so a few years ago, we leased property in the Pico Union neighborhood where we were renovating a 100-year-old sanatorium to instead house 62 of our recuperative care beds. And the number one thing we did to build trust with that community was be present. We would be on site every day. And there were some individuals that actually sat outside our facility and just wanted to talk and learn about what we did and what we were doing and what we were bringing into the community. And we got to know a lot of the immediate residents because it's in a little bit of a residential area. There's a park right across the street, but there's a lot of housing all around us. And so individuals living there wanted to know what was happening, what were we bringing? And in addition to being present and listening to what their issues were, we took action on what their issues were. So for example, they were concerned about, will the funding on the street in front of our facility be taken up and they won't be able to park there anymore? We made sure not to have that be the case. We found another place for our employees to park that wouldn't take up their street parking. We promised to create some jobs for the community. We actually hired individuals that lived very nearby to become employees for that facility. And then we provided opportunities to enrich the community beyond that. So based on their input, we started a community garden there. We have a volunteer program where some of the ladies that live in the neighborhood have stitched all of the curtains for the rooms there. And it's become more of a hub. And so it was really all about being present, showing we're committed to being a good neighbor and to actually being a good neighbor. So
I think that's great. And Eleazar, let me just pull in another question on the same topic and kind of focus it in for you. This is from Maria Khan. Health data is one of the places where privacy can be an extremely sensitive matter. How are you fostering the promotion of health data while promising privacy and security? I think your work is very much right in this realm.
So that's a really great question. I would say that UCLA, and rightfully so, takes a very conservative position on sharing health data. So for example, UCLA doesn't think that it's their data. They think that the data belongs to the patients, and UCLA is just the steward of that data. And so when we, first of all, there's two components. One is for any kind of research that's done, there's a consent process that, patients are kind of explained what the research is, and they decide if they want to participate or not. So there's that component. And then also the data in general doesn't really leave kind of UCLA to kind of keep it as protected as possible. So that's one component. I would say that the other component is that there's a lot of transparency with medical data these days. And in particular, individuals now, because the laws are changing, individuals can really request their own data and see what's there. And so I think all of the way that things are moving will create this environment where there's kind of a lot more trust between patients and the medical community related to their data.
Great, thank you. And just as a reminder to folks on the chat, go ahead and feel free to post ideas that you have about how you could use data or that you are using data in your own projects. So I'll come back to one queued up by Lucas M, who was asking about how we all collaborate, like how the three of us collaborate together. So let me just expand that a little bit. And Eleazar, you can talk about our previous and our current collaborations. But maybe just maybe a little broader, like how do either of you collaborate with partners, maybe with the government, but also with other partners, and kind of set up those collaborations to continue to provide outcomes? Danielle, why don't we start with you?
Thank you. So in a lot of cases, for example, the city's county Department of Public Health or the Department of Health Services, LASA, they provide grants and contracts for NHF to do our work. And so we couldn't do a lot of our work without those, and we cherish and value those partnerships. And there is a lot of data sharing that happens in those situations. And so we are always trying to work toward transparency and sharing that data as best and as thoroughly as we can. I think we both continue to learn how to improve and best serve, improve services and best serve those residents through that data sharing. And so I think there's invaluable learning from that. But beyond that, in terms of partnerships, for example, our recuperative care program with our dynamic CRM has really enabled us to go a step above in terms of the data we can share with the hospitals that refer guests into our program. We're able to look at the financial impact of the referrals that they provide to us, and to follow up with those guests to see if they become return patients at those places. And so it's a constant back and forth between understanding what your partner's needs are, being able to meet those needs, but also expecting that kind of partnership in return. And it has proved very valuable.
Great. Eleazar, anything to add?
Well, I know I would just say that you know, I would say that, you know, we, up until really the pandemic, almost all of our kind of collaborations were really within UCLA or within the scientific community or within the medical community. It's really the COVID which really created this kind of impulse and kind of will to really go outside. And we're really looking forward to partnering with the city, the county, other institutions within Los Angeles to do these projects moving forward. We're kind of inspired by the kind of interest in science and the interest in health of the community. We want to take advantage of that enthusiasm to work together with kind of stakeholders outside of the university.
That sounds great. And certainly we welcome any collaboration, and the work we've been doing with the county's public health department has been really helpful. Eleazar, particularly, thank you. I'm going to just hit a couple of questions really quick. So Lucas again asked about kind of the ability for the city to provide data. So we have an open data portal. I think somebody linked to it early on in the chat. The county also has one. And I'll just mention a Data for Good project that is currently underway with Jagjit Diwali from the county CIO's office helping to manage this, which is really a regional hub for COVID data and projects and initiatives, so that we can try to put together some of this work that's going on. And having, I mean, normally that happens a little more organized, but because COVID happened so fast, there's lots of projects standing up and lots of data being collected. So we're trying to sort that out. So that's a project under Data for Good. And then we, there's also a question here, I'm going to give you a tough one at the end, from James Hawks. As an engineer, historically, we would share investigative data and results. But as a society member, I'm hesitant about the loss of freedoms when insurance companies obtain hard trends. So just this idea about people being concerned about, I don't know, James, if that's really kind of to like how their data is being used, but maybe kind of around that rather difficult question. Eleazar, have you guys thought through that at all?
Well, yeah, I mean, we've thought a lot about this because in the genetics, you know, my background is mostly in genetics, and I've worked on analyzing genetic data, and there's a real issue related to like if you look at people's genetics, you can predict what diseases they're at risk for, then how would that affect people's insurance potentially? Well, the good news is that there's a lot of protection in you know, kind of, there's been efforts by the community and protection and legislation kind of within the ethical framework to protect people. So I think what we really need is we need the data scientists, people in the data science community to really have an eye on these kinds of issues and understand how data is shared, to really be transparent with individuals about the importance of what the risks are to having their data available. But then also, I think we need to have policy and legislation that would protect individuals to have their data being shared and how their data can be used in ways that can negatively affect them.
And Danielle?
I think he covered that one.
It sounds great. So I've tried to catch most of the questions. I know there's a few that are still outstanding. We will be providing the recording of this webinar afterwards. I'd like to take this moment to thank both Danielle and Eleazar for the amazing contributions that they're giving every day, but also for the work that they did today to help share kind of how they're navigating through this. I'm just going to kind of go over our survey results here. So it looks like people were interested in understanding how to learn how to use data that can be used for social good. And then Subhash, if you want to present some of the other, do we have some of the other results? A lot of folks are working in different fields. So there's some government, healthcare, but mostly in nonprofit and technology, which is exactly the group we were hoping to connect to. We really think that what we've heard from folks in Los Angeles and the Southern California area is that you know, some organizations and big businesses and government have data teams or people who are data scientists or data savvy. It's the nonprofits who really need to promote their advocacy for different aspects. And so some of these issues are really ones that we want to help those groups be able to provide. Some of our upcoming webinars are going to be around how data impacts your life around social justice, environmental justice, and education. And so we're not going to focus just on health. We're going to focus on a variety of areas that are important to folks in Los Angeles. And we do have a fairly comfortable audience working with data, which is great. So we could have talked more about APIs. But I'm glad to see that we've got folks from across the spectrum. I do also want to just mention that we have a large upcoming event at which you'll be able to hear more of this. DataCon LA is coming up in late October, the 23rd through the 25th. Maybe Subhash, you can drop the link into the to DataCon and be able to jump in and hear about more of the work that's going on, maybe dive into more about data ethics or hear more about what your local government is doing, or find out what groups are doing around social justice and environmental justice. There's a lot happening in Southern California. Danielle and Eleazar are two examples of the amazing people who use data every day to make all of us healthier and safer and happier in Los Angeles. Clearly, in this pandemic and economic recession, it is a challenge to all of us and our organizations to continue to help people thrive. But I just want to make sure that each of you has the tools you need to be able to make things happen for your organizations. I'm glad if you enjoyed the event today. I welcome all of your questions and participation. We'll follow up with, there's a survey that we've dropped the link in, but if you registered, we'll also follow up with an email and some information about our future events. Danielle, Eleazar, Maria, Katie, Subhash, thank you so much for your work in putting this together. And again, thank you for all the work you're doing every day. Take care, stay safe, and use your data.
Thanks, Jean.
Thank you.